Jennifer Velez is Senior Vice President of Community and Behavioral Health at RWJBarnabas Health. Jen, good to see you.
Good to see you too.
Separate, or you know what, clarify behavioral health, and then we'll talk about community health together.
Behavioral health is someone's state of well-being.
Is it mental
right?
health?
It's mental health, it's substance use disorder, it's everything that involves the brain and emotion. But it's a disease, so mental illness is a disease. Substance use disorder is a disease. It's a disease like cancer, like diabetes, and we should treat it no differently than those.
You know, we were at a forum, I was hosting a forum and you were in the audience, but a key player in the audience with the Mental Health Association of New Jersey, and I remember we did this. You said a disease just like cancer, just like some other terrible disease. To what degree do you believe the stigma still exists? Like, no, it's not. It's not really that.
I think that stigma is probably one of the most pressing issues we have for people to access care as freely as they really need to. I think
that they need it.
They absolutely need it. And actually what you talked about, the forum that we last were together, that was such a beautiful forum because people were talking freely, openly about, I have mental illness, I suffer from, whether it's simply depression and anxiety, or I have something much more serious like schizophrenia or bipolar disorder. So once we begin to treat that as the disease it is, or some combination, we'll really begin to get to somebody's whole health. A good example might be if you have a cardiac issue, you've had a heart attack, you've had cancer recently, there's a chance, a really significant chance that you will also suffer from some depression that follows.
Connected to it?
Connected to it.
But we'll deal with the cancer, you'll get that treated, you'll get the heart.
That. And you'll leave maybe not having your behavioral health, your mental illness, even assessed to see whether or not you're having any feelings of depression or anxiety. It is a spectrum. It is from one end of, from one end of the spectrum to another. And I think we're comfortable talking about some aspects of it, but depression is more than simple sadness. And bipolar and schizophrenia is on the opposite end of the spectrum, and that seems very scary. But
I'm sorry for interrupting, Jen. I'm thinking about this. I disclose what I think I need to disclose or it's appropriate. But Jen and I have had offline conversations, frankly, about family members, and I've reached out for help and advice. I've often wondered, you know, I've talked to at times, like I don't want the family member I'm talking about to know, and all that secrecy. You see that a lot. Is
prohibiting people from reaching out for help. It's not a
like, why am I hiding it?
Why are you hiding it? When we have celebrities, I guess, as probably a good example, say, I suffer from depression, I suffer from anxiety, or my kid does, or my mother does, it releases, and everyone sort of exhales a bit to say, I do too. No. And I really believe there's a degree or two of separation among each of us to say, it is my neighbor, it is my mother, it is my daughter that also suffers from this too. So there's no hiding it. The more that we can really elevate mental illness and substance use disorder, which, you know, as you can't, you know, lose a day without picking up the newspaper, hearing some story about
right.
the, you know,
the tragedies,
the tragedy and the epidemic that this has become. So we really do need to talk about this and to begin to treat it appropriately, because unless we do, we won't dedicate the resources to treating it appropriately.
By the way, you're seeing the website up for RWJBarnabas Health. Reach out, get some more information. Real quick on this, the community health piece. Give us one example of what that means.
Oh, community health is. It's everything that's not acute care, right? So you go to the hospital and you get treated, and I would say in our system, you get treated by the best, right? When you are discharged and you're back to your community, your care for yourself or your family member continues. So what is, and particularly with vulnerable communities, which is primarily an area of my focus, so what are those other factors in your life that will ensure that you have a successful healthcare outcome? So that is, you know, all of the determinants that you hear about. And interesting, I think, that in someone's sort of circle of their whole life, about 30% is really their medical issues. 70% really, you can give or take, is really everything else in their life. Their environment.
Give me 30 more seconds here if we could, team, extra. So it's around them, their health issues. People say crime. It's not a health issue, but it is.
It is. Crime is a health issue. It's whether, you know, the environment in which you live. If you have, I mean, you hear this around whether you have mold in your apartment or you have, you know,
asbestos or lead.
All of those environmental factors that are going to begin to also interact with your ability to be healthy, whether you have asthma or, you know, COPD. So they were always sort of talked about, these factors, as sort of extraneous from your health. But what we know is in order to keep you healthy, you can keep coming back to the hospital, we'll keep treating you. Symptoms. But in order to keep you healthy, these are the things you really have to address. So that's the community side. So what are those factors that are going to influence you to have a successful and healthy life? Transportation, your job, crime in your neighborhood, your ability to access healthy food. So they're more than just sort of factors that someone else thinks about. We need to think about that and act upon them.
Let me ask you this. The opioid crisis in New Jersey, how bad is it and what do we need to do?
It's destroying individuals and families, right? But the drug crisis in New Jersey, and I would dare say nationwide, has been destroying individuals and families for a long, long time. I do think that demographically, the crisis has been hitting suburban areas in more rapid succession. The numbers have really grown incrementally, significantly over the past set of years. And I think resources are now allocated to really address the crisis, to address the epidemic. But I think it's fair to say that the drug epidemic has been in urban neighborhoods for a long, long time.
Do you think that's not a coincidence, Jen? That there's more focus than ever before on this?
I don't think it's a coincidence. I think it's a little unfortunate, but the silver lining of all of this is that if we have resources available now, they're available to everybody, and that's how we're addressing it. And in our system, I think one of the best things that we're doing
at
RWJBarnabas Health is we have peer recovery specialists in each of our facilities, and actually in a couple of others that aren't our facilities as well, based upon how we applied for some grants when they first came out. So we're really helping our own hospitals as well as some hospitals outside of our system. But we're helping them with people who are peers. So when a parent, when a doctor, when a nurse says to you, I can get you help, you need to get help, you can't do this anymore. If I'm somebody who's a substance use disorder, and this has been in my life forever, I'd say, get out of my face. When I'm a peer, I say to you, I've been in your shoes, and I'll stay with you. And that has made the difference. In greater than 50% of the time, we're able to engage with the person at the bedside, coming in after having nearly died, reversed by Narcan, brought into the emergency department. And for the medical professionals in those emergency departments, they've been a godsend because, medical professionals want to help, docs, nurses, they all want to help. And nothing has really been able to get through as effectively as a peer, someone who's been in their shoes.
And that's what's happening at RWJBarnabas Health on a regular basis, and you and your colleagues are doing it. And to disclose, your organization has been a big supporter of public broadcasting, and the CEO, Barry Ostrowski, serves on the board, if you will, of public broadcasting.
Great leader, great visionary.
Jen, I want to thank you for joining us. It's one thing to have great offline conversations with you, but also to talk to you right here, and you helping a lot of other people makes a difference. Thanks so much.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by NJM Insurance Group, the Terrell Fund, the New Jersey Education Association, Rowan University, Bardley Healthcare, the New Jersey Reentry Corporation, and by New Jersey Sharing Network. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.